How to prevent anemia naturally. Anemia occurs when there are not enough healthy red blood cells, RBCs, to carry oxygen to all the cells and tissues of your body. Anemia can be chronic or short-term and range from mild to severe. Anemia can be caused by many different causes, such as heavy menstrual bleeding and irritable bowel syndrome. There are many forms of anemia, but some can be prevented very easily. Others cannot be prevented, but they can be treated. If you follow a few simple steps, you can understand anemia and learn to prevent it naturally. Prevent anemia naturally. Eat more iron. The most common anemias are nutritional deficiency anemias. Iron is the most common nutritional deficiency seen in anemia patients. To prevent this kind of anemia, you need to include certain kinds of foods in your diet to get more iron. Men and non-menstruating women should get about 10 milligrams of iron daily, while menstruating or nursing mothers should get 15 milligrams daily. Pregnant women should get 30 milligrams every day. Try to incorporate more iron-rich proteins such as lean red meat, liver, poultry, pork, and fish. Try more spinach and other dark green leafy vegetables, such as Swiss chard, mustard, beet and collard greens, broccoli, various lettuces, and kale. Also eat more tofu and other soybean foods, peas, lentils, various colored beans, chickpeas, dried fruits, prunes, raisins, apricots, and prune juice. For breakfast or a snack, try iron-fortified cereals and iron-fortified whole grain breads. You can also cook in cast iron cookware to get additional iron. Avoid iron-absorbing substance. Certain foods can decrease iron absorption. If you want to prevent iron deficiency anemia, do not drink tea, coffee, or cocoa with meals. They will absorb the much-needed iron from your meal and it will not go into your body. You should also not take your iron supplement with these liquids as well for the same reason. You should also avoid milk and dairy products because the calcium in dairy products may decrease iron absorption. Incorporate more vitamin B12. To prevent the kind of anemia where you need more vitamin B12, bring more vitamin B12 into your diet. You need 2.5 mcg of B12 every day. Pregnant women should get 2.6 mcg per day, and if nursing, you need 2.8 mcg every day. Include vitamin B12 rich foods such as beef, liver, poultry, sardines, salmon, tuna, cod, eggs, milk, yogurt, and cheese. These all have natural vitamin B12 that will help up your levels and help your anemia. You can also eat food that has been fortified with vitamin B12. Try breakfast cereals, soy-based beverages, and vegetarian burgers with added vitamin B12. You can also take a vitamin B12 supplement to help increase your levels as well. Try foods with extra folate. You can also get anemia from a deficiency in vitamins such as folate. To prevent this, incorporate more folate-rich foods into your diet. Men over 13 years old should have 400 mcg of folate per day. Women over 13 should have 600 mcg per day. To get more folate, eat foods such as spinach, beet and collard greens, Swiss chard, broccoli, mustard, lettuces, kale, lentils, black-eyed peas, pinto beans, chickpeas, kidney beans, beef liver, and eggs. You can get foods that have been fortified with extra folate, such as bread, pasta, and rice. There are also good amounts of folate in fruit and fruit juices, such as bananas, oranges, and orange juice. Get more vitamin C. Your body needs vitamin C to make healthy red blood cells, which is the main factor in preventing anemia. Adults over 19 should need to get a minimum of 85 milligrams of vitamin C daily. If you are a smoker, you should get an extra 35 milligrams daily. If you want to boost your immunity, you need a dosage of 1000 milligrams. To get enough vitamin C, eat fruits such as oranges, grapefruit, tangerines, lemons, limes, kiwi fruit, papaya, pineapple, strawberries, raspberries, and cantaloupe. There are also many vitamin C-rich vegetables, such as broccoli, red peppers, Brussels sprouts, tomatoes, cabbage, potatoes, and leafy green vegetables. Vitamin C enhances the absorption of iron, so the vitamin C-containing foods can be taken with the iron-containing foods. Take supplements if necessary. It is always best to get your vitamins and minerals from foods. If you eat foods rich with the vitamins, for the most part, they should provide you with all the vitamins and minerals you need. If you worry that you might not be getting enough from your food intake, you can take a supplement of iron, vitamin B12, vitamin C, folate, or any other vitamin or mineral. Just because something is natural or required by the body does not mean you can't overdo it. Iron is a good example. There is a condition called hemochromatosis that can be hereditary or acquired and occurs when you take too much iron as a supplement. It can be very serious. Seek medical advice. If you are not sure what type of anemia you may be susceptible to, you may need to seek medical advice as you start your natural treatments. There are many forms of anemia and there can be serious consequences if anemia is handled incorrectly. You should be careful because, with certain forms of anemia, extra vitamins and minerals can actually make your condition worse. Before you can prevent anemia, you have to understand if you are at risk for it. Understanding anemia. Know if you are at risk. You only need to prevent anemia if you are at risk of developing anemia. There are a number of risk factors for anemia. Some anemias that are preventable while others, such as the hereditary or genetic anemias, cannot be prevented. Risk factors for anemia include nutritional deficiencies that arise from a diet lacking in the vitamins and minerals needed by the bone marrow. The bone marrow produces red blood cells and a deficiency of necessary vitamins and minerals for the bone marrow causes the production of red blood cells to decrease. The major vitamins and minerals needed are vitamin C, riboflavin, B12, folate, iron, and copper. A deficiency anemia can also arise if you are overweight or obese. Intestinal conditions, such as Crohn's and celiac disease, irritable bowel syndrome, irritable bowel disease, and leaky gut syndrome, as well as other chronic diseases, can prevent the absorption of nutrients and put you at risk for anemia. Women are at risk during their menstrual cycles and pregnancy because of the significant loss of blood or lack of absorption of iron during these high-stress times. If you have chronic blood loss because of a bleeding ulcer or if you use certain medications, such as high-dose aspirin or other NSAIDs like naproxen, Advil and others, you may be more susceptible to anemia. Your medical background can play a part. A number of anemias are passed down in families and cannot be prevented. You can also get anemia if you have a personal history of alcoholism, certain viral infections, liver disease, exposure to toxic chemicals, or a history of certain medications. Recognize the symptoms. Even if you try your best to prevent it, you should know the symptoms just in case you start to develop them. This way, you can increase your preventative measures to reverse the early stages of anemia. The symptoms of anemia can vary depending on the specific form you have. However, there are some symptoms that are general to most cases. These include fatigue, general feelings of weakness, pale skin, rapid or irregular heartbeat, shortness of breath or difficulty breathing, chest pain, dizziness, confusion, memory loss, cold hands and feet, and headaches. If you are experiencing any of these symptoms, make an appointment to see your physician to determine the cause. The symptoms of anemia can apply to many other conditions as well. To get the proper treatment, you need to get a medical diagnosis. Treat anemia medically. Despite your best efforts of preventing anemia, there may come a time when you need medical attention to help prevent, reverse, or deal with your anemia. The treatment for anemia depends on the type, cause, and severity of the anemia. Vitamin and mineral deficiency anemias are treated with dietary changes and supplementation. In the case of pernicious anemia, Vitamin B12 is replaced by intramuscular injection. For anemias due to blood loss during menstruation, hormone treatments may be considered. For anemias due to autoimmune disorders, immunosuppressant drugs may be used. Blood transfusions or a bone marrow transplant may be performed in severe and rare cases of anemia. If the anemia is due to internal bleeding, surgery may be required to stop the bleeding. Sickle cell anemia is treated with oxygen, pain-relieving drugs, blood transfusions, or supplements. Antibiotics are also prescribed to treat concurrent infections which may set off a sickle cell crisis.